Welcome to our KLAS Insights podcast. My name is Jared Peterson. I'm here hosting our podcast today, and I'm joined by two wonderful guests today, Jennifer Hickenlooper, who is an Insights Director at KLAS, and Ryan Pretnik, who's a Research Director at KLAS. Thanks for joining me today, you two.
Thanks for letting us join you.
Yeah. Sure. So we're here to talk about an exciting, fun report that the two of you just finished. With, a lot of blood, sweat, and tears into this report. I know it took a lot of effort, but we want to talk about healthcare AI and our recent report and some of the findings from that report. Ryan, I know we did this report, a similar report, a couple of years ago, and our first report in this area. This is our second one. Could you just kind of lay the foundation for us on what we're talking about with AI, and then what we learned from the last couple of years from the first report we did to this one?
Yeah, Jared, great question, and thanks for having us again. When we look at AI in general, KLAS looks at four techniques of AI, and they're really machine learning, NLP, robotic process automation, and then AI and imaging, okay? That's really where we focus. This report is really highlighted on machine learning and data science, so building, creating models for predicting whether it be like readmissions or opioids or anything in like pressure ulcers, et cetera, right? So we're really talking about model creation, building, deployment, and then being able to predict the future, whether it's financial, clinical, or operational outcomes. So that's where we really honed in on this space. And there's a lot of excitement here. There's a lot of interest, there's a lot of learning that still needs to go into this space. So that's one thing I think when we started our first report in, I want to say it's 2018 is when our first report came out here in the space. What we learned is that a lot of people didn't know what use case to go to. They didn't know if they had the right data. They didn't know how to operationalize this. And so it was really fun and interesting to learn, why did people choose a model? Why did people decide to maybe try to push this out to more of the staff without really understanding how they were going to use it? So that goes back to change management. So when we first started, it was more of a learning curve per se, right? For a lot of healthcare organizations, they just said, you know what, we think we have a readmissions problem based off of some of the data that we see. Let's apply AI here and see how it could work. Well, we saw that there, but the outcomes were very few and far in between. So some organizations saw it, some said, you know what, we're not quite there yet, right? And in our first report, we looked at roughly around 90 different use cases from about 50 organizations. Fast forward to now, we obviously had a lull in COVID, right? COVID absolutely impacted this market, Jared. And everything AI that could be applied to COVID was applied. But if it was a use case outside of COVID, it was put on the back burner for right now, because it was, let's keep the EMR up and running. Let's make sure we have our staff right. Let's make sure that we're focusing on COVID patients, right? So we saw a little bit of a transition in AI, but the one thing that's been constant is that we've seen consistency, that we know it can work. If you know the right use case, if you have the right data, if you bring in the right people internally to have that buy-in, they will just inherently start driving outcomes here. So we've seen a transition from let's test AI to now let's actually operationalize it and start driving outcomes. And that's took a few years to really kind of get moving.
Great. So it's fun to see the energy that's happening.
Absolutely,
here.
Absolutely.
So Jen, let's talk a little bit about the report itself. Maybe could you just take a minute and highlight who the players are that we covered in this space?
Yeah, perfect. So we focused for our performance data on 5 vendors. The EMR vendors, Cerner and Epic, are in it. And then we also have Health Catalyst, JVon, and Closed Loop AI. And this report really delves into who has really been able to get to outcomes. Like Ryan was saying, originally we would see people put in models and not really get there. And so this report really focuses on who's able to get there and some of the changes we've seen with each of these vendors in the market the last few years.
Great. And talk to us a little bit about also just kind of high level performance, like what we're seeing at the performance data, like from like the changes from maybe a couple years ago to where we are today,
Yeah.
High level performance.
Perfect. So high level, we have a couple of vendors who have really been able to partner with the people that they're working with and really help guide them to get to outcomes. And so those vendors are doing significantly better than some of the others who are giving them the models and just trying to let them run with it. And they're not really sure what to do with the outputs that they're getting. So we talk about a lot of that in the report.
You know, Jared, when we look at overall vendors and the performance, it's about having some pre-built content, experience, and then the ability to kind of handhold the provider through the process. We've looked at a lot of our research through the past, and we found that even if a provider thinks they might know, hey, we have the team, we have the resources, we have everything, sometimes they haven't deployed, sometimes they haven't got the business involved. So we really recognize that hand-holding from the vendor is very important. Actually, in our 2020 AI report, we looked at the number one reason that a provider would buy a solution, an AI solution, and the number one reason was healthcare expertise. Healthcare expertise from the vendor, right? And that was fascinating because typically when we look at that in decision insights, it's really focused around product, functionality, delivery of new technology, the wow factor. But in this case, it's like providers saying, you know what, I kind of know what I'm doing. I think I have the right staff. We'd love some hand-holding from the vendor and helping us. And that's why we've seen Closed Loop, Health Catalyst switch their approach and do really well as they move forward.
Yeah, good. Well, before we jump into the case studies, let's talk a little about, there was a chart in the report that talks about ease of use and its correlation to driving outcomes. Maybe we could talk about why that's an important piece, why we pulled that out, and what we were seeing around ease of use and its importance to driving those outcomes.
Right. So just because the models can give really cool data, if the providers who are using this, like the physicians and the nurses and the ones that are really boots on the ground, if they don't know how to action the data that they're getting, then they're not actually going to get to outcomes. They'll just have really cool dashboards that can predict things that they're not doing anything about. And so those vendors that were easy to use, we were able to see that they're able to get to those outcomes a lot easier.
One other thing I might add, Jared, is time to value is really key here. We've seen a lot of organizations when we started in AI back in 2018, it was taking 12, 18, 24 months to get to a prediction and then trying to figure out how do we get clinicians, physicians, nurses, people to actually use it and take action on it. We've kind of moved that up. So some of the pre-built content that you don't have to go build the whole model, number one. You already kind of have an idea what data that you need for it. We've seen some use cases already flush through. So we've seen the time to value. So time to value is easily tied to ease of use as well. So those correlations come very well. And if you look at Closed Loop, you look at Health Catalyst, and even Epic in certain instances, where they have a quick time to value with a model, they provide some support, they diagnose the problem that the provider has, and then being able to flip the switch and say, you know what, in 6 months, 8 months, we've been able to get the predictions into a physician or nurses or someone's hands, and then they can actually take action on it, which increases, overall quality of care, which is the absolute hope here. So again, time to value has been really key. So if we're in that 12, 18 month phase, might feel a little bit long, but when you get something in 6 months, 8 months, and you're starting to feel value and there's starting to be excitement, that excitement just starts to accelerate throughout the organization.
All right, so let's jump in and talk about some of the case studies that were included in this report. I know there was a lot of work into these, and we found out some great things from some of these organizations that are doing some cool stuff with AI. So Ryan, maybe jump in and talk about one of the case studies, and then we'll have Jen highlight another one.
Yeah, totally, Jared, and thanks for sharing this. This report was really focused on the art of possible. So we wanted to involve the provider community and the payer community to really understand what they were doing, how they were doing it, why they were doing it, so we could shed some positive influence out there. That's our whole goal of this report. And St. Luke Health Network, which was one of the providers that we spoke with here, and they were gracious enough to share their whole experience. Fascinating where they were. We look at how they partnered with Kensai. When they first started, they wanted to focus on optimizing care management. That was kind of the whole goal, okay? They started with Kensai and they said, you know what? We want to build a model to help with care management. Kensai said, great, let's partner together and let's try to drive some sort of outcome. Whatever that outcome is, we'll figure out that measurable as we start bringing in the business leaders. So when we look at the St. Luke Health Network case study, they started with AI, and then they realized, is that the actual problem that I really need to solve for? Or is it something different? So Kensai in St. Luke actually took a step back from AI and said, you know what? We need to really focus on analytics first. We need to get a dashboard and reports and information just to consume data. Because if we start trying to predict something, we don't even know if it's the right use case. I love how they stepped back. They said, you know what? Maybe we're too quick to jump into AI for care management and closing gaps in care for our care managers and making sure that we take care of our population correctly. So they took a step back, they focused on a dashboard, and they really, really touched on what are the use cases that we should be going after. When they were done with that, they realized initially some of the use cases that they were hoping for, the model wasn't an exact fit. They had about 10 different use cases or so that they were thinking about and realized that only 3 or 4 were really applicable for AI. So I love how St. Luke took a step back and said, you know what, we need analytics first. And now they're starting to apply AI. They're focusing on care management. They're really optimizing that role, using and predicting where gaps in care are. And they're still early on in the process. And that's why we wanted to highlight this, to say, look, it's okay that AI wasn't the silver bullet to start, but we know that it can be applicable and it can be applied. We just need the data to make sure it's applied in the right places. And in this case, it was focused on, again, optimizing care management, which we hope to get some good outcomes here in the future from them. So that was one that really stood out to me. And I love that they really took the bull by the horns and said, you know what, we need data first. And that's been a really good approach. And we're seeing that more often in healthcare.
Great, good. Yeah, let's hit the other one, Jen.
Perfect. So I chose a health plan to talk about. It's Health First, and they also applied to care management on really trying to get their patients to adhere to their medications and also look at those who are at high risk for being readmitted to a hospital. And they used some pre-built models to do this with. And one thing I really loved from this case study is they said that your data doesn't have to be perfect. It needs to be good enough so that you know that what you're getting is good out. You don't want garbage in, garbage out.
Yep.
But they said you could spend years trying to refine your data to make it perfect. And so they said just implementing models when it's good enough so you can start getting those outcomes and learning and making adjustments as you need to was really key for them to get to success. And I really love that they were able to really look at each member that they had and determine how risky they were, and then also the best method to reach out to them to try and help improve their adherence to these different things that they may not have been likely to follow.
Yeah, great. Yeah. Thanks for sharing both of those examples. I know out of all the case studies, we were able to kind of distill down some successes, some recommendations, if you will, on what can help drive success. And we broke them up into a couple different areas: pre-implementation, implementation, and change management. Maybe we could just share a couple of those learnings from each one of these areas to kind of give folks kind of a teaser, if you will, of what we learned about. Maybe Jen, you could share about the pre-implementation piece. What are a couple things we learned about that?
That sounds great. So in the pre-implementation phase, one of the biggest things that we learned is that you really need to find out what problem you want to solve before putting in models. You could go and take a bunch of models and put them in, but if you don't know what you're actually trying to solve, then you just might have really cool models. So yeah, that was one of the biggest takeaways there. And then making sure that you take the time to get your data to a good place and knowing what you're getting in and what you're getting out are going to be quality.
Okay, good.
Yeah.
Ryan, what about on the implementation kind of successes that recommendations?
Absolutely, Jared. Making sure you involve your staff and your team. Don't just make it be an IT project, right, or a data science project. Involve the business users, involve some of those, make sure that they're involved with the testing, make sure that they understand what's behind the model and the creation, right? So as you're implementing, as you're thinking about how you build the model out, et cetera, you absolutely want to make sure that your team's involved, because at the end, if you just give them a model and say, hey, you know what, go test this out, a physician or a nurse is going to say, you know what, I don't want to risk that on my patient, right? I need to know what's behind there. So involving the team, making sure they understand, make sure they trust the model, so when they get that prediction, they can actually take action on it and they entrust that. Huge benefit for the whole organization if you involve them during the implementation process too.
Yeah, that sounds very critical. Then what about the change management side, Jen?
Yeah, so after you get the model put in, that is almost actually the easy part from a lot of these organizations that we talk to. What really get you to those outcomes is to have change management and to continually be building on that and make sure you have buy-in, like Ryan was saying, with your both physicians or staff members that are using these models, and meeting frequently to keep making adjustments and keep pushing to get to the next outcome and seeing where you want to continue to go with your models, or if you should implement new ones as well.
So lots of coordination, discussions, just to make sure everybody's coming along that journey is what I'm hearing.
Yep.
Absolutely. That's great.
Yep.
Great.
It's not a one and done, put in system and you're good. Yes.
It's kind of like the EHR, right, Jared? Yep. You give a physician buy-in, you give them the opportunity to learn and have their voice heard, or a nurse. You could tell, like, it correlates to satisfaction, and we absolutely see that with AI too. There's so many pieces and complexity areas of AI that if they're not involved, it becomes nervous, right? A physician or a nurse, they care about their patients. They absolutely want those outcomes for quality of care. And if it would affect that, or if it's another click, or it's something more that they don't entrust, I mean, it's absolutely key. Last thing I'd point out is that you probably want to make sure that we're looking at helping them realize the outcomes too, right? Mm-hmm. Sometimes, you know, they're so busy, they have so many things on their plate that and they're seeing so many patients that they might say, you know what, this is great, it's helping me predict, but what is that doing? Is that increasing the quality of care? Is that making sure that they're not being readmitted? Is that making sure that we're, you know, have all the right medications? And so helping them understand what those outcomes are actually helps really fuel a fire for AI internally.
Yeah, and I did want to point out that though me and Ryan have focused a lot on the clinical outcomes, we're actually seeing a lot of organizations implement this into their operations to try and improve operation cases as well.
That's great.
Yeah.
Broad applicability here, right?
Yes.
Absolutely. Okay, great. Well, thank you so much for taking some time to look over this report. And I want to just, before we close, talk about what's the next step for KLAS? What do we see happening? Kind of maybe tease what's the next report we're going to be doing in this area. What are you two seeing from that perspective as far as the next steps and what we're watching here in the future?
Yeah, you know, Jared, good question. We're going to take a small little break on AI just to get some excitement blown back into it with the COVID lull. We'll probably move on a second performance report later on this year that is specifically designed around machine learning, model creation, building, which we just discussed. So that'll probably come later this year. Again, full performance, kind of see after COVID what's next. And then furthermore, we've had a lot of interest recently in something called Conversational AI. It's a technique of AI. It's around NLP. We're getting a lot of asked about that. So that's something that Jen and I will start working on probably this summer, this fall, and would love to put something together because we're having a lot of questions. How can some sort of NLP technology, robotic process automation, help vendors, help nurses, help providers overall, especially with the staff shortage and the ability for them to, you know, continue to do what they're doing without getting burnt out. So more help supported them with technology and AI.
Great. Well, we'll look forward to all that information. Jen, I'm sure you're excited to jump into that data once we have it and everything.
So excited.
But thanks again for taking the time to talk about this. An exciting topic and lots of great things to come, I think, and lots of opportunities for us to really improve patient care and help, you know, make a difference for patients.
Absolutely.
Yeah.
Thanks
so much.
us.
Yeah. So thank you again for joining us on a KLAS Insights podcast in this discussion with Ryan and Jen on our Healthcare AI report. If you'd like to learn more about this report and others, you can visit our website at KLASresearch.com. Also, if you have any experience with Healthcare AI solutions and you'd like to give us your feedback, please go to our website at KLASresearch.com and complete an evaluation, or feel free to reach out to Jen and Ryan or myself. We'd love to hear from your experiences on using AI. Thank you.